This segment of Coast Life is sponsored by Beebe Healthcare.
Well, Coast Life, if you have had to go to several doctors, maybe for several different reasons before, you know it can be kind of tricky to keep track of all of that medical information and keep in touch with your medical team. But at Beebe Healthcare, that's not really going to be the case anymore. We're really excited to introduce you to Carrie Marble, Chief Administrative Officer, and you really recently started with Beebe Medical Group. And tell us a little bit about what you guys are doing to sort of merge a lot of medical information with this epic launch that's coming up.
Thank you, Leah, for having me.
Of course.
We are so excited. So we are moving to Epic November 1st. It's right around the corner. And with Epic comes a patient portal called MyChart. And really that's what we want our patients to become familiar with and look forward to using. And MyChart will be the patient portal for all of their healthcare needs.
Yeah.
One-stop shopping.
And that's going to be huge because I think sometimes people hear patient portal and they're like, oh, here we go again. Yeah, one more thing to keep track of. What will MyChart allow patients to do and utilize when it comes to, you know, making this an easier thing to keep track of?
Good question. So currently, right now at BB, we have at least, I think, 3 different portals for patients to have to navigate through. So with MyChart, it becomes one place, one portal. And within that portal, patients will be able to send their provider messages. They'll be able to pay their bills, and also just accessing their health information, their lab results, any other diagnostic imaging on there, or just reviewing their latest visit with their provider.
So this really does streamline everything, especially if you do end up needing, you know, maybe multiple doctors across multiple teams with BB. You can find all that information all in one place.
You can find it, and the staff is also aware, so if you're messaging your provider, and say you have a whole host of questions, the staff might say, hey, we need to schedule an appointment. We need to get you in because it's more than we can answer in this message. Or it might be just a really quick answer to a question that you had that you didn't remember what your provider said, and they can answer it for you. So it's a great way to stay in contact or get an appointment if the staff or provider deems it necessary for you to come in.
Yeah, absolutely. And this isn't the first time that you've, you know, helped transitions like this to Epic MyChart. You know, how do you kind of help streamline that process?
Yes. So I just came from a similar size system in upstate New York not too long ago, and we went go live with Epic in March of 2025. So it's very familiar to me right now. And it does take a village. I think the biggest thing for MyChart is to get the word out, to get patients comfortable signing up for their usage on MyChart, and then just continuing to get the word out there that this is available and this is the quickest way to access your healthcare information. It's seamless. It's so fast.
Well, we like the sound of that. We like the sound of seamless and fast and an easy process, especially with something as important as taking care of yourself. So speaking of signing up, is there a way that people can start doing that now?
So it goes live November 1st. So that's when you'll start signing up. That's when patients will start signing up. But there are multiple points of access to get into Epic. So you certainly, when you're at your provider's office, you can sign up. Their staff will be more than knowledgeable and helpful getting patients signed up. There will be various community outreach events to sign up, because when you sign up, you do need to get an activation code that gets you in and then gets you set up. So we're going to be out there 7 ways, 7 times to get this information out to our patients. So don't worry if you're not signed up yet. It doesn't start until November 1st. And then we will make sure anyone who wants to be on MyChart is on MyChart.
Perfect. I mean, easy peasy. So be on the lookout, especially for those outreach days. I think that's a great way, because then you're kind of face to face. You can ask the questions that you have, and you can ask the pros here, and they will guide you through it so that it is that easy, streamlined process.
And there are a lot of questions. I know, people have asked me, does it cost anything to be on MyChart? The answer is no. No, it does not cost anything. Does it take a lot of time to sign up? It does not. But if you're with our team out at community events, you can ask all those questions.
Now, you mentioned, one of the biggest pros for MyChart is its convenience, but it also kind of, it spans all your medical information.
It does. So this just isn't Beebe Healthcare Epic. What it does is it enables you to access your MyChart from other healthcare institutions like Jefferson or Hopkins. So you're expanding into all of those other MyChart networks, and it's this seamless, again, I keep using seamless, but it is a seamless healthcare record that you'll have access to every point of contact that you go to within your healthcare journey.
Perfect. Well, Carrie Marble with Beebe Healthcare, thank you for coming in today, and thank you for what you're doing to kind of help streamline this process and make it so that life is going to be a little bit easier for patients.
Yes.
All their information is going to be in one place.
We're excited. Thank you, Leah.
Of course. We do have some more Coast Life coming your way, though. More fun that you don't want to miss, so don't go anywhere.